Well, I have absolutely no idea what's going on here.
Not showing. Still not showing. It shows you guys were there.
Well, all right. Hello and welcome, everyone. My name is Ben Hawkins, and on behalf of Amber Grissamore, the program manager for Food Safety Lodging Program here at KDA, I'd like to welcome everybody here to today's webinar. I serve as the grants coordinator for the program, and I appreciate everyone taking the time here to join us for our Food Protection Task Force annual meeting. For the next 3 hours, we'll be focused on topics important to our stakeholders. These topics are important to our licensees because they cover a combination of new and emerging topics in food safety, and then some topics of interest that were voted on by our stakeholders from a poll that we ran last year. We do read your feedback, and we appreciate everyone who does engage with us and help contribute to the task force within the past year. Before the session begins, just a few housekeeping items. This meeting is being held in person and virtually. For those of you here in person, please hold your questions and comments at the end of each presentation. For those online, during the presentation portion of the session, all participant microphones will be muted by the meeting host. If you have any questions during the presentation, for those in person, please raise your hand and wait to be recognized by the host, and a microphone will be brought to you so you can have Can online hear me now?
Yeah,
Yep.
Yep. Sorry about that. I'll start over. I'll make it quick this time. Welcome, everybody. My name is Ben Hopkins. We really appreciate everyone joining us this afternoon, taking some time out of your day for our Food Protection Task Force annual meeting. For the next 3 hours, we'll be focusing on topics important to our stakeholders. We'll cover a combination of new and emerging topics as well as some existing topics of interest. A little bit of housekeeping for those online. You can put any questions that you have in the chat and we'll answer them at the end of each presentation. And then there will also be a general Q&A session at the very end from 3:45 to 4. If you do have any questions at the very end for speakers that might have already left, we'll make sure we get those questions answered to you and we'll get to those speakers. And we are recording this session. We will post it online next week. And I'll send a link out to the recording in our next quarterly newsletter that'll be sent out at the end of July. And additionally, we will be sending out a survey also next week, just to gauge some feedback, how you like the speakers and comments that y'all might have, anything like that. So now that that's out of the way, I'd like to introduce George Blush, our Agribusiness Services Division Director at KDA, for a quick welcome for our participants.
Thank you, Ben. As Ben said, I'm the Ag Business Services Director for the Ag Business Services is basically our inspection division. It includes 7 programs, including the lab. It's got food safety and lodging, dairy and feed, which you'll hear some from the feed program a little bit later on. So I want to welcome you here. We got about 80 people online, plus a room full today, so we had a good turnout. So we got in-person and virtual, but the Food Protection Task Force was organized, I don't know how many years ago, Amber, probably
2018 about.
So it's been around a while. It's provide resources. They do a quarterly newsletter. It's provide resources for human food and animal and / pet food professionals like yourselves. And today we've got owners, we've got operators, we've got quality control managers, we've got academia, and we've got the regulators. And so we all work together to apply the preventative measures to protect our human and food and our pet food and animal food supplies. And so that's what the task force was created for. We have all have a role, whether that be in intervention and preventive guidance to our facilities, reacting to any foodborne and feedborne illness on the animal food side, and we respond to contain those illnesses. But we all have a role to play. And, you know, you look at today's agenda and you look down here through how broad, as we go through here, we've got academia going to talk to us today from the Value Added Meats Lab. We've got worker illness. We'll have a presentation on cooling and heating. We've got a food processing presentation. We have a feed presentation. So look at how broad it is. And we have a broad range of influences. We all go out and do our jobs, whether we be owners, operators, or on the regulatory side or on the academic side. So it's all a partnership. Speaking of partnerships, if you're aware at all, you've all heard in the news, the federal cutbacks in our FDA programs. Still up in the air. We don't know how that's going to impact our programs and everything. However, the need for food safety continues, no matter where the funding is going to come from. You've all seen the bumper sticker, if you eat, you're in agriculture. Well, if you eat, you're in food safety. So the same is true. So it's a partnership. So a lot of times all of our hard work in food and feed goes taken for granted. The public isn't even aware of it, doesn't even give it a second thought, because the incidence of foodborne illnesses are contained because of the work that we all do in this room. Years ago, when I started, our food programs and our feed programs were partially funded a lot by state general fund tax dollars. But over time, the industry our legislators and lawmakers have brought it to where the industry is funding a lot of that. And so sometimes our policymakers aren't educated. I had an old boss years and years ago that told me in food safety, once every three to 7 years, we need a good foodborne outbreak to let us know how important we are, to let the general public. But we've all done such a good job. Foodborne illnesses are kind of few and far between. So we just need to educate our policymakers, any chance you get, the public, the job you do, food preparation, serving the public, and regulating those industries. So anyway, again, I just want to welcome you to our meeting today. I'm looking here at some notes. One of the things that the Food Protection Task Force does is provide a lot of resources and educational material, and you can find them on our website. I think it's www.agriculture.gov. And that's under the food safety program. You can find all the guidance documents and everything for our program. So anyway, I hope you can take away a lot as we go through the speaker agenda today. Like I said, it's broad topics. Food safety and feed safety is broad, covers a lot. So I hope you learned something today, take it away and apply it back in your respective professions. Turn it over to Ben. I don't think you've got any questions to me.
Thank you.
All right, thank you, George. Our first speakers are from Kansas State University. We have Karen Blakesley and Dr. Liz Boyle. Karen's an extension associate and co-director of the Kansas Value Added Foods Lab. She specializes in food science for extension agents, and Dr. Boyle is a professor and extension specialist. Her areas of specialization are HACCP, meat safety and quality, and processed meats. So, take it away. So let us know.
All right. Can you hear me out there? I'm sure somebody will say if it can't. Well, good afternoon, everybody. As Ben said, I'm Karen Blakesley. I'm an extension associate for K-State Research and Extension in Food Science. And for today's purposes, I am also co-director of the Kansas Value Added Foods Lab, along with Dr. Kelly Getty, who's up here in the front with me. And then Dr. Boyle handles the meat side of our program. So I just kind of want to give you a little introduction of what we do. If you happen to not be familiar with who we are, a little history about our program. So the Value Added Lab has been around for over 30 years. Many of you may know Dr. Fadi Aramoni. He's the one that originally started this program. He retired about 5 years ago. So Kelly and I have been in charge of the Value Added Lab since then. We partner with the Kansas Department of Agriculture and they provide us funding, and hopefully we'll get funding for next year, crossing our fingers. And we greatly appreciate that partnership that we have with them, because that helps us pay for students to work in the lab and some other things that this funding can help support. So we're very appreciative of that. It is a partnership. And we also work with the From the Land of Kansas program, which many of you are probably familiar with, the marketing side of KDA. So we do lots of programs around the state together, and just to show that we do work in partnership and making sure that food processors are making their products safely. What we do in the value added lab side of things is handle everything that's under FDA regulations. And then Dr. Boyle handles all the meat side of meat products that are under USDA regulations. So I like to say we do everything except meat. So, which is a lot of things. So anyway, we work from small businesses that are just selling at farmers market, a lot of direct to consumer companies, to those that are standalone businesses, such as Karen, who is here from Flint Hills Pints. I'm glad to see you today. We've done some work for her and her ice cream operation. If you haven't had her ice cream, it's really quite good. And so we see a wide range of people that are just getting started to those that have been in business for quite a while. All our work is confidential. We don't share anything. And in fact, we actually make our students sign a confidentiality agreement so that they don't share anything. So, just in case somebody asks, just know that it is all confidential. This is our contact information, as you can see here. Dr. Getty is our process authority. And so those, products that do need a process authority review or a process authority letter, we can help with that. So we will look at their formulas, how they're making their products, what kind of packaging they're putting it in, do a review of that, make sure it's meeting all the right, regulations, and then we can, generate a process authority letter for them. We also do nutrition facts labels, and we do a lot of those. Now, most of the businesses that we work with are small enough that they would fall under the FDA exemptions where they wouldn't have to have a nutrition label, but it is good information for consumers to know. It's, people want to know what's in their food a lot more today than ever. So, we do make a lot of nutrition labels, and that's a whole nother side of the business that we have. So the product testing, you can see, the last bullet there, just a little snapshot of the testing services that we do offer. From pH, water activity, we do sodium testing mainly for the nutrition labels to make sure that we are getting an accurate representation of what the sodium content is in their products. We can also do percent Brix, which is a measurement of the amount of sugar, especially for jams and jellies. We do have to make sure that they're meeting the FDA regulation to actually call it a jam or a jelly, which is 65%. So, we've also done some moisture testing. We've done a little bit of fat testing. We do some basic microbial, which is just the foundation of, coliforms, standard plate count, and yeast molds. And we mainly do that if we happen to be doing a shelf life testing. That's not something that we do for everything, but every now and then we get a client that is asking for a little, shelf life testing. So we do basic microbial with that. You can see some numbers there. I put it in the labels and under PA letter and the product testing, and just a snapshot of the numbers of, letters and labels that we've done up until March of this year. So this is a snapshot from July to March. Don't have the fourth quarter in there yet, so that's coming, because the fourth quarter is not done yet. So, I do have one student working in the lab this summer. During the school year, we've had, this past school year, we had about 8 undergraduate students, and it's great experience for these kids to get a real life view of what food manufacturing is and what, these folks need to do. And many of them have told me that, what I've done in the lab has done more for me to get an internship or a job than just about anything else. So it matters. And so we're very grateful that we can help all these small businesses out there. All right, just a few things I thought I'd share. We do have a publication on food labeling. If anybody is needing some information, this is something that we've had out for a few years now. And this is tailored to Kansas food processors. So you're welcome to download this and share this with folks. This is on the food labeling side of things. One thing that we've put together about 10 years ago was a publication primarily for those selling direct to consumer. So like farmers markets or any other direct to consumer opportunity. And this is something that we've worked with Adam and the Department of Ag since the beginning to make sure we get the regulation side of things in there along with anything else. We also include meat and egg, selling eggs information in there, poultry, even live plants. This is a big publication and we go through it every year to make sure it's as current as we possibly can make it. This year, we do this in January, and this year, we got it printed, and then all of a sudden, hey, you forgot this, hey, you forgot that. So we've actually had to tweak it just a little bit, even up through April. Hopefully, we're done with that until January. So anyway, this is a big publication, direct to consumer folks. This is very helpful for them. These are some other ones. If you want to scan the QR code, that will take you to these. We've put together some publications on the hot fill hold process, water activity using a digital thermometer, and then some other topics that have come up pretty often. We are going to be offering a better process control school in October, so save the dates for that. If you know of anybody that needs to take this class, we do it via Zoom. We don't have all the details out yet, but we at least wanted to let you know that we are going to be offering this in October 9th and 10th. There we go. And then another resource is we are a part of the North Central Food Safety Extension Network, which is 12 states here in the North Central region. And one of the topics that we cover is food entrepreneurs. And so we have some resources on this website too, that you're welcome to take a look at. We also have a newsletter mainly tailored for home food preservation, but that is a big topic. That's my whole other life that I do as far as doing education. We also have a Kansas Local Foods program. We do some local foods town halls. We have one coming up here in July. That you're welcome to participate in. If you go to our Kansas Local Foods website, you can sign up there to get information about that. We do this from 11 o'clock to noon. Trying to get partners together, get people talking to each other. That's really kind of the bottom line. We're also having a local food summit in July, the 29th and 30th. This will be in Salina, and y'all are welcome to come to that too. This is the second time we've done this. And it was a big success last year. We did it down in Wichita, so we moved it to Salina this year. So if you're interested in that, check that out, the QR code there. We are also part of the Heartland Regional Food Business Center, which is KDA is a part of that too. We provide technical assistance, so when clients contact the Heartland Center and ask for assistance, we can provide testing for 2 of their products at no cost. And so it saves them a little money and helps get their business up and going. So that's another resource that we have out there. And we've completed work for 11 businesses so far since this program has been in place. If y'all haven't been on campus, there is a brand new building going up and it is huge, and this is what it looks like. And our lab, which is currently in Call Hall, will be moving to this building sometime in the fall of next year from what they tell us. So we will be on the 2nd floor, at least as far as I know. Nobody's moved us yet. But that's where we're gonna move to. There's a whole lot of activity going on. So take a drive around campus just down the hill here. It's a big building. So this is our contact information. Please, send people to us or contact us. We're happy to help. And we want to make sure that people are doing things properly. So I'll be around, and Kelly will be around too, and answer any questions. And I'm going to turn it over to Dr. Boyd.
All right, can you all hear me? All right, I'm Liz Boyle. I'm a meat scientist at K-State. I've been there for over since 1992. So I've been around a long time, have worked with small businesses associated with the meats industry for many, many years. And Karen's provided you with a lot of great information related to food products. Meats are a whole different ballgame. The regulatory status for meats are a bit different. So if we think about the meat poultry industry, they operate under a different regulatory structure. So what you're doing for FDA products, we need to view differently for USDA or state meat and poultry because of the differences in regulatory status and we have different inspection categories, state, federal, and custom. We also have a retail exempt category, so if I was just at a plant yesterday in Plainsville, Kansas. They're making product in a room in the back. They're selling it direct to consumers. They aren't state, federal, custom. They are retail exempt. A question I get a lot is, I want to start a meat business. What do I need to do? Because of the cost of starting a business, a lot of times I encourage new entrepreneurs to think about looking at a co-packer. Have someone else make it for you first and see, can you get a market for it? Can you get this product out there? If I'm under state inspection, I can only sell that product in the state of Kansas. If I'm under federal inspection, I can sell that product anywhere in the US. If I'm custom, I can only sell it direct to the producer. Producer brings an animal in, has it harvested, meat gets packaged, and the meat package will say, not for sale. And that producer can't sell it to their relatives. They can give it away, but they cannot charge their relatives and say, hey, I've got all this meat, I'm gonna sell it to you and you can have it for this cost. Can't do that. That's what custom means, is it's not for sale. So co-packers are an option. We have a lot of retail exempt processors who are making it in their back room and then selling it direct to consumer through their retail counter. So they own a storefront, they don't harvest meat. The meat has to be sourced from an inspected facility. Entrepreneurs, I work with entrepreneurs a lot. Again, folks who say, I want to get started in the business. I make this jerky product. It's a great product. All my friends and neighbors love it. They tell me I need to sell it. What do I need to do to get started? So there's a lot to do to get started. Oops, sorry. Breeze past that. So if I'm going to do retail exempt, USDA does have some conditions that retail exempt can sell a limited amount on wholesale. It depends on what the product is. It has to be a fresh product. It cannot be a processed product. It can't be cured. It can't be smoked. And they have a dollar limit associated with that. That dollar limit changes annually. So the retailer has to know what the limit is. So some of the common questions I get. I raise livestock, want to start a meat business. I want to direct market meat. How can I market meat from livestock I've produced? How do I get started? That's a big question because there's so much with the meat industry in terms of the regulatory process and the supporting food safety programs that are required if you want to sell meat products. I want to make and sell jerky. What do I need to do? What do I need to do if I want to vacuum package a product? How does that influence my product? So a lot of what I do is education with people in terms of educating them about regulations, about safety, about the different programs they need to be considered. So when I get these questions, my response is usually, it depends. What are your plans? Are you planning to be state, federal? Are you planning to be custom? Are you planning to be retail exempt? Are you doing something that you want to sell at the farmer's market? If I want to go sell at the farmer's market, I still have to have an inspected product. So that means I'm falling under regulations, and those regulations are going to be different than what Kelly and what Karen deal with on a regular basis. So the meat industry, very highly regulated, goes back to the Meat Poultry Inspection Act back in the early 1900s. So we are still very regulated. If I'm a meat processor, I'm gonna have an inspector. If I'm processing meat and making cured meat, smoked meats, whatever, I'm gonna have someone in my plant multiple times a week. If I'm harvesting, I'm gonna have an inspector in my plant every time I harvest an animal. Under KDA or FDA regs, you may have someone in there. If you're FDA, once every 3 years. So again, a huge difference in regulatory oversight. So some of the questions I will ask is, where do you want to market your product? Because that will help dictate what kind of regulatory status you need to move under. Who's gonna be your client base and what's important to your clients? What kind of products are they looking for? Have you done any market research or made connection with local retailers? So as Karen already mentioned, a lot of networking associated with cross-marketing products. A lot of our meat processors do that. They will cross-market products from people who are making jams, jellies, barbecue sauces, honey, mustards, because that helps them market their products of, hey, I make this great product. You could make a really nice Reuben out of that if you use summer sausage from this processor and the mustard from this processor. And so trying to sell multiple products. What kind of products do you want to market? Are you making a fresh product that you want to market? Are you wanting to make a product that contains nitrite? Nitrite has regulations associated with it. Well, I'm making a no nitrite product. I'm using celery powder. Celery powder is a different delivery form of nitrite, and USDA is actually looking at how you're going to have to potentially relabel those products. So I'm going to expect to see changes in the future in that. Think about what's my point of differentiation? What makes my product unique? What is my niche? What am I doing differently that makes somebody want to buy my product versus Jack Lake's or one of the big name products that's already out on the shelf? When we make jerky, and I put this up specifically because I work with a lot of folks who want to make jerky, and we have guidelines we have to follow. So a very important document that needs to be read is the jerky compliance guidelines. Very lengthy document. Why do we have this document? Because even though jerky is a shelf-stable product for a lot of processors, some processors sell it refrigerated, we have to meet conditions for safety. We have had salmonella outbreaks associated with jerky, even though it tends to be a lower water activity product. Jerky, salmonella can survive on jerky under drying conditions. So someone tells me, hey, I bought this dehydrator at Bass Pro or Cabela's and I want to make jerky and I want to market it. How are you going to introduce humidity into that product? Because we have to have a humidity spike in the process in order to control the safety, and we have to use supporting documentation to prove that we've done it this way. So it's not just, I'm gonna make jerky in a home dehydrator and sell it, doesn't work that way. If I'm gonna do reduced oxygen packaging, what kind of inspection are you under? Are you under state or federal? Or are you under Kansas Food Code? So we have to know what kind of regulatory status you're under and what you need to meet. If you're doing vacuum packaged product, regardless of where you're selling that product, you're going to have a HACCP plan. Where do you get that HACCP training? Well, you can come to K-State, we offer it twice a year. You can do online training, not going to be nearly as effective because there's a lot of nuances with developing a HACCP plan that isn't necessarily picked up with online training. How long is training? 2.5 days. So we're looking at 2.5 days, 20 hours of time. It's not something that I'm gonna go learn, read about for an hour and learn how to develop it. And I've been training HACCP since 1992 with companies. And people walk out of that training and say, wow, that's a lot of information. How am I supposed to apply all of this and absorb all of this? You've been to my HACCP training.
I have. That's absolutely true.
It's a lot of information in a short period of time. So it's a very important preventative food safety program that if we're going to do reduced oxygen packaging, we need to have that training. USDA also has standards of identity for jerky. So we can't simply just make a product and say, call it jerky. We have to know something called the moisture protein ratio. How do we get that? We have to analytically measure the moisture content, the protein content, come up with this value to find out, do we even meet the standard of identity to call this product jerky? Water activity, we want to have that at 0.85 or less ideally. And so we measure water activity for a lot of companies. What about selling larder tallow? That's a question we've been getting more of lately. It does require a HACCP plan. It's a heat treated shelf stable product. USDA has regulations in a book called 9 CFR, Code of Federal Regulations, Book 9, in section 315.1. So you want to make sure that you're looking at what does USDA require in order for the product even to be made in, beef fat to be made into lard or tallow. Under our retail food code, there's no specifics, but it's a ready to eat product. And the retail food code for Kansas says you do have to meet USDA regulations. So that means you're gonna look at what 9 CFR says. Also think about what your liability insurance covers. And a lot of processors don't always think about what do I need liability insurance for. You're selling food products, meat products to consumers. If there is a food safety issue, even if there's a quality issue, you need to have insurance that's going to cover you if there's a problem. Has there ever been a recall associated with lard or tallow? There's actually been one, just a few weeks ago. What happened? There was this company called Sulu Organics that purchased pork lard and bulk beef tallow from an FSIS regulated facility. They repackaged it into smaller packages and then sold it. They didn't do it under USDA inspection. It's a USDA regulated product. So even simply repackaging a product involves regulatory requirement. So if you're an entrepreneur, if you're a processor, you need to be aware of what those regulatory requirements were. Yeah. Some of the questions, if you're going to use a co-packer, what are the fees associated with co-packing? Who's going to be responsible for the label development and paying for the label? Who's going to store the product and where can it be stored? So you can go through, read through these questions. There's a lot of different things to just consider when you're going to go ahead and use a co-packer. If you say, I don't want to use a co-packer, I'm going to build a facility. How much is it going to cost? Often a new facility is going to cost you at least $1 million. So it's not, I'm going to go build the small little thing and it's not going to be expensive. There's a lot of costs associated with it because there's certain standards you have to meet with building a facility. Facility I visited yesterday, they have a retail facility. They want to be able to move into USDA. It's going to require some investment in order to move into USDA, some reorganization, changing what they're doing now in order to step up, to go from retail exempt to being expected facility. So there's a lot of things to take into account with break-even costs. I put up some resources. I don't have a nice code for you to use, but there's some great resources through the Niche Meat Processors Association, through KDA, there's a local meat and poultry processing and the importance of business commitments, and another good one from SARI on direct marketing beef. We do offer a lot of assistance to Kansas companies, so generally what I tell people is give me a call. And let's talk through it because as I said early on, it depends. There's times I get questions I shoot out to Adam or my peers with KDA and say, what do you guys think? And then we have a discussion trying to figure out where do you actually fall in this regulatory process and what you need to meet. So we do HESAB trainings. They cost, right now the cost is $450 for trainings. We do an annual Midwest Meat Processors Workshop, usually in the spring in Manhattan. Right now our meat lab is closed because of the construction. So I'm trying to locate that elsewhere. I do a lot of phone consultations, working with deviations with plants, because you have a HACCP plan and operating under it, something goes wrong, what are you gonna do? So usually what happens is the processor calls me and I work with them on deviations. So we also do nutrition facts labels for meat poultry products, guaranteed analyses for pet treat, and then all kinds of analytical tests. I'm working with one company right now where they're looking at ingredients from one supplier, but they have two co-suppliers they get from, and they want to develop product specifications. Well, what do we need to put in those product specifications? What are you doing now with your main supplier that you need to build into product specs from your co-supplier. So lots of technical support. And again, just like with the Kansas Value Added Lab, everything's confidential. So best way to get a hold of me, phone, that's not me. My email, call me on my phone. If I don't respond right away, I do get back to you. So make it take a couple days sometimes, but I will get back to it. I do want to mention briefly, we do have a new person on staff, Dr. Erin Byer. She is also a meat extension specialist, whereas I'm food safety, processing, quality, and all the things you've seen here. Erin said her programming covers topics like beef grading, meat cookery, meat judging, pricing on the grid, and meat in the meat case. So she's his fresh meat counterpart. So if you have fresh meat questions that are not safety related, I will send you over to Erin. Thank you all.
Thank you so much to Karen, Dr. Boyle. Right. We've been monitoring the chat for questions. I did see some comments on the building. Looks beautiful, those renderings of it. Do we have anything, Casey, from online? In person, do we have any questions for either of the Value Added Foods Lab folks? Well, I have one. My question is for Dr. Boyle. You mentioned a lot of people ask you about jerky. You asked them, how do they introduce humidity? Well, how could they?
So, if someone's using a home or a dehydrator, not a home dehydrator, but a commercial dehydrator, I have had to work with companies where they have had to buy a separate unit that introduces steam and do some mechanical work. So they have a steam generator that introduces steam in the process. There's also, you have to be able to measure wet bulb and dry bulb. So you can buy some equipment that allows you to get those measurements. There's a variety of ways to approach it, but there's going to be some investment with it.
Thank you. And sorry about the slides. They're advancing on their own. I'm not sure what's going on with them. Thank you again for both of your time and expertise this afternoon. Our next speaker is going to be online, so I will stop my share and allow him. Our next speaker is Dan Nisus. He's a senior epidemiologist with the Kansas Department of Health and Environment, Infectious Disease Epidemiology and Response. He's going to be presenting on restriction and exclusion for food workers with diarrheal illness. Dan, thank you for joining us. You should be able to share your screen now.
I think you're seeing my screen, and I think you're not seeing my speaker notes.
Yes, we can see.
Okay, great. I'm Dan Nisus. I'm a senior epidemiologist at the Kansas Department of Health and Environment. I have been here for 20 plus years, and we work with KDA often on foodborne illness investigations, outbreak investigations, the occasional issue with Legionnaire's disease in a hotel, all sorts of stuff. So I'm located in Topeka, Kansas, in this infectious disease epidemiology and response section of KDHE. And my section within KDHE conducts surveillance of all reportable infectious diseases other than tuberculosis and STDs and HIV. So that includes multiple diseases that can be transmitted by food, most notably Salmonella, Shiga toxin-producing E. coli, which we sometimes abbreviate as STEC, and Listeria. Kansas regulations require laboratories and physicians to report to KDHE when someone tests positive for or are diagnosed with reportable diseases. And for the diseases listed on this slide, they're required to report to KDHE within 1 business day. I'm going to go ahead and turn on my video. I meant to have that on. Now it is on. This is a real human being speaking to you and not a recording. Okay, so for those diseases I mentioned, the patient's positive specimen is sent to the KDHE laboratory and whole genome sequencing is conducted there. That information feeds into a national database where we can see any other people who were infected with the same bacteria with the same genetic fingerprint. At the same time, a telephone interview is attempted to speak with the patient about the foods they ate in the week before they became sick, places they may have traveled to, animals they had contact with, and other possible causes of illness, since these illnesses can be transmitted by food, but could also be transmitted by other methods. That's one way we identify outbreaks related to food, through those interviews and through the lab testing. Then those could be outbreaks that are in-state, caused by a local restaurant or something grown here and sold here, or also nationwide outbreaks related to food supplied to chain restaurants or grocery stores. And we work with KDA, local health departments, and if needed, CDC, FDA, or USDA on those outbreak investigations. Another way we can identify and investigate outbreaks is through foodborne illness complaints. Our section receives complaints from citizens about illnesses they believe were caused by a food establishment. So a common example is a restaurant, but we also get complaints about foods they purchased at a store or at a farmer's market, or even food that was catered to their event, or maybe they went to a party with catered food. All of those complaints can be submitted through the same place, this foodsafetykansas.org website. If you go to that website, it used to be a standalone website, but now it redirects the users to a web page within the KDHE website. This is a screenshot from that website. We implemented this in 2017, and it directs complainants to file a report with KDHE if illness was related to food, or if illness was not the issue, they can file a report directly with KDA if there's a problem that did not cause illness. And you can see they click on the left to report illness. They'll be taken to a questionnaire in Qualtrics, which is the online software that KDHE uses. And then KDHE shares the information from the complaint with KDA so they can perform an inspection. If the user is reporting something that did not cause illness, like seeing a mouse in a restaurant, they can click Report Concern button on the right, and they will file a report directly with KDA. This is a chart of the number of illness complaints submitted through Food Safety Kansas by year. These numbers are not finalized, but we have cleaned this data to remove complaints that were incomplete, or they filed a complaint, but when we read it, we determined it's not really an illness complaint. So this is preliminary data, but it's cleaned a little bit. Some people still use a telephone to report issues like this to the KDHE epidemiology hotline in our section, or by calling KDA's number to report. But now most of the reports we receive are online, and we have received between 300 and 600 illness complaints per year since we have had this website active. All right, so that's a very brief background on who I am and how we do foodborne disease investigations at the state level and the local level. Next, we'll discuss KDHE regulations and the Kansas Food Code that require food handler restrictions and exclusions for certain diseases. KDHE regulations, or the Kansas Food Code, require persons diagnosed with certain diarrhea-causing diseases to be excluded or restricted from work that involves food handling. These diseases include hepatitis A, norovirus, salmonella caused by Salmonella typhi, also called typhoid fever, as well as salmonella caused by other non-typhoid species of salmonella bacteria. Typhoid is not common in the US, but non-typhoid salmonella is very common. Then there is Shiga toxin producing E. coli and shigellosis. We'll cover the KDHE regulations as it applies to food handlers, but it also applies to healthcare workers and daycare workers and daycare attendees. The purpose of those regulations is to prevent disease transmission, and some of these diseases can be severe. And we're ensuring that a person is no longer infectious before they return to preparing or handling food. Okay, so the regulations and the food code are written for persons who are diagnosed with these diseases. And I just wanted to take this slide to do a quick timeout and talk about diagnosed. So keep in mind the majority of people who have an enteric illness and who have diarrhea don't necessarily go through the multiple steps that it takes to be diagnosed with a specific disease. To be diagnosed, you have to decide you're sick enough to seek medical care. So you may be severely ill or have symptoms that won't go away and have lasted for several days. Then you see a doctor. Then the doctor will have to collect a specimen for testing and ship that to a lab and get a positive test result back. Then another day might pass while you wait for the positive result to be communicated to you, the patient. And if it's one of the diseases that we mentioned on the previous slide, the worker is supposed to notify their supervisor of their diagnosis. The lab and the doctor are supposed to report those diseases to the state or local health department, like we mentioned on the previous slide. And in order for public health to identify that this positive person works with food, that person would need to answer our telephone calls and complete our interview. And many people do not answer the phone for an unknown caller, or do answer the phone and refuse to speak to us, the health department, for their interview. So all of those things have to go right for us to identify someone as a food worker. And this final bullet point, the other way you could be diagnosed with something is if you are ill with the same symptoms as someone in your household who already tested positive. So we would call those people probable cases rather than confirmed cases who were laboratory positive. So this iceberg image is taken from a CDC graphic about the number of cases of foodborne illness reported to the CDC. And the same idea applies to the number of food handlers who are diagnosed and interviewed by public health. The number of people who are diagnosed with these diseases are just the tip of the iceberg, and the number of diagnosed people interviewed by public health staff are the tip of the iceberg. For those workers who never saw a doctor, who had diarrhea for a few days and then felt better, they may still have an organism like norovirus or salmonella or E. coli in their bodies and are still shedding it in their stool and still able to transmit the disease to others, even though they are no longer having active diarrhea. So even if a person was never diagnosed, if you have a worker who returns from work after being ill with diarrhea or vomiting, they need to practice careful hand washing and hygiene for weeks after they no longer have symptoms. All right, now let's cover definitions, an exciting topic in exclusions and restrictions. So we're defining food handlers as anyone working with unpackaged food, food equipment or utensils, or food contact surfaces in a food establishment or a food processing plant. Exclusion and restriction have different meanings. Exclusion means that a person is not allowed to work at the facility in any capacity. If someone has diarrhea, they should not be working in any food facility until they're asymptomatic for 24 hours. Then, unless that facility serves food to high-risk populations, like a food worker in a hospital or an assisted living facility, the worker's exclusion is over, but they are now restricted. Restriction means that the individual can perform some duties. However, those duties are limited. They cannot work with food, drinks, or clean equipment and utensils, but they could work as a host, bus tables, or load dirty dishes into a dishwasher. In a restaurant setting, these activities are limited, but duties may be more broad in other settings like a convenience store. And you can contact KDA if there are any questions about what type of duties a restricted food handler can perform. I mentioned high-risk populations just now. The food code has a definition for highly susceptible populations, which is persons who are more likely than the general population to experience foodborne disease due to being immunocompromised or being preschool aged or being a senior citizen. Food handlers that work in those facilities that I mentioned, like healthcare, childcare, assisted living, they have to follow different rules for restrictions than a food handler who works at a, quote unquote, normal facility. And for the purpose of this presentation, to keep the rules simple, I'm only going to talk about rules related to food handlers who do not serve high-risk populations. The first disease we'll discuss is norovirus. Norovirus is the leading cause of vomiting and diarrhea from acute gastroenteritis among people of all ages in the United States, with an estimated 19 to 21 million illnesses per year. The majority of infections occur from November to April in the United States and the Northern Hemisphere. The incubation period averages between 12 and 48 hours for norovirus, meaning that it can take that long from the time you are exposed to when you begin to have symptoms. The duration of illness averages between 1 and 3 days. Those who were infected can continue to shed norovirus in their stool for 2 weeks or more after their illness ends. Norovirus is the #1 foodborne illness, causing an estimated 58% of all foodborne illnesses in the US. Foodborne transmission is usually caused by an ill food handler with poor hygiene contaminating a ready-to-eat food. Since you can continue to shed noro after your symptoms stop, there's a continued risk for transmission if your hand hygiene is poor. Less commonly in Kansas, there can also be transmission from contaminated shellfish, like raw oysters. Since oysters are filter feeders, they can harbor norovirus if the water that they were living in contained norovirus. And since they're often eaten raw, enjoyed raw, I'd even say, there's no kill step for norovirus. Norovirus is also commonly transmitted from person to person. Surfaces that are contaminated by unclean hands or aerosolized vomit can lead to transmission. We see many norovirus outbreaks in schools, nursing homes, and even cruise ships. There is no KDHE regulation for norovirus, but there is guidance in the food code. The workers should be excluded until they are no longer having vomiting or diarrhea for 24 hours. And then they can work on a restricted basis until they are asymptomatic for 48 hours. Like I mentioned, you can continue to shed norovirus for weeks after your symptoms stop. So there's a continued risk for transmission if hand hygiene is poor. When the restriction is lifted, the need for perfect hand hygiene should be stressed to anyone who had norovirus. Next, we'll talk about these 3 bacteria that are kind of grouped together on this slide. We have S-Tech, Shigella, and Salmonella. These are all enteric bacterial illnesses. All of these bacteria can be spread by food, although they could also be transmitted from person to person, or from animals to humans, or from other sources to humans. When you hear about nationwide outbreaks linked to food, these are usually caused by S-Tech and Salmonella. Last year, there was a notable outbreak of S-Tech linked to the onions served on McDonald's Quarter Pounders. And there were 2 outbreaks last year of Salmonella linked to cucumbers. And actually, we just had another one this spring of Salmonella linked to cucumbers. While these bacteria's average incubation period is a few days, it can vary widely and can range up to 7 or even 14 days for Salmonella. All usually cause fever and diarrhea. S-Tech and Shigella can cause bloody diarrhea. S-Tech can cause a severe complication called hemolytic uremic syndrome, or HUS, which can lead to kidney failure, permanent health problems, and even death. Shigella and Salmonella can also cause complications like reactive arthritis, seizures in children for Shigella, and septicemia or blood infections. The KDHE regulations and the KDA food code were written or adopted at different times, so they do not match on all diseases. For the food code, it states that for both Aztec and Shigella, a food handler should be excluded until they are asymptomatic for 24 hours, then restricted from food handling until they have 2 negative stool culture tests performed, or until they are asymptomatic for 7 days. The KDHE regulations for these diseases is more strict, and we follow the KDHE regulations. They require negative tests. There is no or wait until they are asymptomatic for 7 days option. And for Aztec, the regulation states they must have 2 consecutive negative tests, while for Shigella, it states they only need 1 negative test to return to work rather than the 2 listed in the food code. The food handler can return to work and resume all food duties after they have those negative tests that show they are no longer shedding bacteria in their stool. We have had some issues, especially with childcare, actually, where patient's doctor writes a note that says the person is free to go back to work or daycare, but those doctor's notes are not an acceptable substitute. You have to follow that state regulation and test negative before returning to work or daycare. So let's talk about what stool culture testing looks like. Stool specimen testing is free through the KDHE lab. It's coordinated by the patient's local health department. And remember, the local health department or KDHE has tried to interview the patient. And if we were successful and we learned that person is a food handler, we talk to them about exclusion testing through the local health department and the KDHE lab. Testing could be done through their healthcare provider, but that would be at a cost to the patient while the KDHE testing is free. And we perform a bacterial culture test on those stool specimens. The local health department would work with the patient to pick up specimen testing kits from the local health department, which includes instructions and everything the patient needs to collect their own stool specimen. And in the upper photo, you can see that there is they call it a collection device that we provide with the stool specimen kit. So that is taped to the toilet seat. Sometimes we call the collection device a hat because it kind of looks like a top hat if you flip it upside down. So that keeps the stool from falling into the toilet bowl and makes it available for you. We also provide a plastic spoon for the patient to collect the stool and put it into the small vial that you see on the bottom right, on the bottom photo. The small vial then gets packaged into the large vial, which gets packaged into the box, and there's some paperwork to fill out, and they take that back to the local health department, which ships it to the state laboratory. A patient should be symptom-free for 24 hours before submitting a specimen. If they were submitting a specimen while they were still symptomatic, it would just return a positive result, and that would be a waste of time and money. Also, if the patient is taking antibiotics, they need to wait until it's been 48 hours since their last dose of antibiotics before they submit specimens. That's because antibiotics can lead to inconclusive test results. Test results are usually available within 4 business days after the specimen is received at the KDHE lab, and the patient should expect to be restricted from food handling for at least a week because of that time required to collect, ship, and test specimens. Most test negative and return to work within 2 weeks, but some people can remain infectious for months. It just depends on the individual and how long they might be shedding bacteria in their stool. Right, so as I mentioned before, there's one strain of Salmonella that causes typhoid fever, and that is a rare disease in the US. Typhoid Salmonella does have a KDHE regulation that requires food handlers to test negative. But this slide is focused on other types of Salmonella, non-typhoid Salmonella, which is common in the US. And we have about 600 cases of non-typhoid Salmonella each year in Kansas. Food code states that non-typhoid Salmonella infection should be handled similarly to Aztec and Shigella infections, where they would need to be excluded and restricted until they have 2 negative stool culture tests or until they are asymptomatic for 30 days. There are no KDHE regulations at this time for non-typhoid Salmonella. KDHE regulations have not been altered since KDA has adopted this version of the FDA food code. And salmonella regulations could be added to the KDHE regulations in the future, but a change is not imminent. We have to draft those regulations here at KDHE, and then they have to pass through legislative approval before they take effect. For hepatitis A, it has more unique symptoms than the other diseases we've discussed. It can cause dark urine, clay-colored stools, diarrhea, yellow skin of the eyes, or yellow skin or eyes, which is called jaundice. And hepatitis A is much different than hepatitis B and C, which can be transmitted through infected blood. Hepatitis A is an enteric illness and is spread when someone ingests the virus, even in very small amounts. Transmission is usually through the fecal oral route, through person-to-person contact, or by eating or drinking contaminated food or drink. The KDHE regulation and the food code do match up perfectly for hepatitis A. The food handler needs to be excluded for 14 days following the onset of illness, or 7 days following the onset of jaundice. And there is no testing related to this to return to work. They have to wait out the entire infectious period for returning to food handling. One special thing about hepatitis A is the incubation period is long. It takes about 2 weeks from the time you're exposed to when you show symptoms. And if a person receives the hepatitis A vaccine within 2 weeks of exposure, it can prevent illness. So if a food handler is diagnosed with hepatitis A and the KDA inspection determines that the food handler may have had poor hygiene or bare hand contact with ready-to-eat food, KDHE and KDA may work together to alert patrons alert patrons of the restaurant about the need for them to get vaccines. So that could be a press release or some other method of identifying people who are exposed. The FDA developed a nice tool that guides workers and management through the food code requirements for different diseases, when workers should be restricted or excluded, and when they can return to work. It's a PDF tool, so there's no need to download a special app. It would work on any phone or computer, just in the PDF reader. And you can download it using that URL or that QR code. And this tool is based on the version of the food code that is adopted in Kansas. This is a screenshot from the PDF tool, and you can see that it covers all illnesses, not only diarrheal illnesses that we've covered. So it covers people who are ill with sore throat and fever, or who have a infected wound, or so on and so forth. And if you love PDF documents, we have another one for you. This is a link to the KDHE regulations that we covered in the presentation. Again, this document covers all illnesses with a regulation, not just the diarrheal ones. So you'll see the regulation for a child in school who has chickenpox or measles or things like that in this document. And that QR code will send you to the PDF. And now I'm finally done talking, and I can take any questions about those regulations or foodborne outbreak investigations or the complaint website or whatever people would want to discuss.
Thank you, Dan, for the presentation. All right. Are there any questions in chat? In person, folks? I'll wait.
Ben, I will throw out. two of our retail colleagues, and then I think it would be applicable, or at least useful guide for folks in the manufacturing space, that FDA has just released an interactive website where you can run through as an employee, food employee, or a food worker, your symptoms, your conditions, your diagnosis, and it'll help guide you through what's required in the initial part, as well as what will be required to be released from that. Of course, anytime you have questions, feel free to reach out, and we partner with Dan's team, make sure we protect everybody's interest in the situation, navigate the kind of complicated landscape of the ill food worker for these foodborne transmission types of conditions.
Thank you for that, Adam. I will say, just as a personal PSA, if you ever do think that you got sick from eating something at a restaurant or otherwise, please work with the epidemiologists that try to interview you. It really helps out just to helps the investigation. If there is something wrong with some food, who knows, far down the supply chain, it's really helpful whenever people actually interview. So you might be off the hook right now, Dan. Oh yeah, Adam's putting links in chat. We are running a little bit early. Do we want to come back at 2:30? Is that okay with people? All right, I think we'll do that. While I have you captive, I want to make sure my tech works, because I think we might have had some troubles earlier. So I'm going to share my screen and try and make sure that everybody online is. So I do this. Can everybody online see this? The meeting will reconvene at 2:30.
Notes.
You see the notes?
There's a switch. Switch that.
We'll be back at 2:30. Everyone in the room, feel free to use the bathroom, get some water. We'll see you tomorrow. Thank you. All right, thank you to everyone for being back, so that we can begin the second half of our meeting. We're gonna hear from KDA staff in 3 different program areas to cover various topics related to food and feed safety. Our first presenters are Adam Evans and Heidi Getz to discuss cooling and reheating methods and procedures. Both are retail inspectors that represent the Southwest region. Heidi's been with us for about 4 years and Adam for 9. Heidi and Adam, floor is yours.
Thank you. Well, thank you for joining us for the cooling and reheating segment. It's not moving. All right, thank you. Well, what happens if foods are cooled or heated correctly?
That's the six.
He's sick, that's right. Looks like we're gonna jump right into the symptoms. We have learned that failure to follow time and temperature control guidelines properly can lead to foodborne illness. We have a list here of the symptoms. What happens if foods are cooled or heated correctly? The bacteria growth gets out of control, toxins are produced. The onset time of these symptoms is 30 minutes to 36 hours. Depending on the germ average, preformed toxins cause illness in 1 to 4 hours. After eating, when food is kept at the wrong temperature and wrong times, people get sick. How do pathogens get into the food? Well, here we go. You can see on the slide, naturally from food establishments, from food workers. We cannot see smell or taste dangerous bacteria in our food, but we can educate ourselves to protect ourselves from foodborne illness, such as Listeria, Campylobacter, E. coli, Salmonella, just to name a few. All right, let's dive into those cooling requirements. Here you go, here's a chart. So the first thing we like to do is get your handy dandy thermometer, starting at 135. Did I mention it needs to be calibrated? That's good to know. 135 to 70 in the first 2 hours. Then in the next 6 hours, we want to get to 41. Our total.
There'll be 6 hours total,
6 hours total. Yes, thank you.
70 in the first two.
So what do you cool and reheat? Can anybody name a few items?
Ice cream base.
Ice cream base.
Macaroni cheese.
Alrighty, that's good. Cheese.
Refried beans.
Refried beans. You see that a lot.
Rice.
Rice. Good.
Potatoes. Mashed potatoes.
Alrighty.
Chili.
Chili. Good. All good. Alright. I think it's fun to conduct your own studies in the workplace. I like to try it on different foods that we cook, do it with employees, make sure that everyone's educated on what works. What cooling methods do work? All right, section A, I think everybody can see that. We have rice. They poured ice into. This is an added ingredient, sorry, to bring the food down in temperature. You can see it's in a shallow pan. B is meat. You can tell in the picture that it is sitting on ice. They're also using the ice wand, starting in the center and working its way out. C is, it looks like marinara. They're stirring, they submerge the pan in ice, at least the equivalent of where the food line is. You can go higher, that's even a better process. E, you can see that they've spread the food out thin, about 2 inches. And hopefully they're stirring frequently. F, you can vent the pans. It's on ice and vented with foil, plastic wrap. It's important that you don't stack the pans before they go into the cooler while you're going through the cooling process. You can see in D where this is a speed rack with food on it. The food looks vented and it's spread apart so that the air is circulating around the pans. And it's in a walk-in cooler. It's not in the kitchen. G, 2 pans, we have metal and we have plastic. Plastic containers insulate the food, whereas the metal will help the temperatures release, whether it be you're wanting to cool it or heat it. So we're letting off some steam. This is a blast chiller. It's a really great piece of equipment if you're cooling high volumes of food. You can see on the side, there's multiple thermometers that you can take temperatures of multiple foods while they're cooling. All right, so the 2-inch depth cooling is really, really important. We're spreading the food out, as I mentioned, into thin layers, about 2 inches. On some pans, there's a line, which we'll get to. You can also use a commercial stainless steel spoon. The handle of it is about 2 inches. You can use that to measure. We want to make sure that we've got a thin layer, that we leave it partially uncovered, vented, as I mentioned. Don't stack the pans. You can do them at an angle and vented to allow better airflow and refrigerate immediately. Be cautious not to stick a lot of hot food into a small reach-in refrigerator at the same time. It will bring the temperature of the refrigerator up as well as all the food that's in it. It's better to use a walk-in cooler. Here's a picture of different sizes of pans. You don't have to have a 2-inch pan. But whatever you do use, it is best to use thin layers of food and stick them in something submerged with the ice up the sides. All right, what's wrong with this picture?
The lid on.
The lid's on and you can see the condensation, right? Anything else?
I think around the whole container.
That's right.
And it's plastic.
It's plastic, the food's above the ice line, very good. All right. So pathogens of concern during cooling, the Clostridium perfringens, the Bacillus cereus are both store forming. And we can't kill the spores. The CDC says that there's 1 million illnesses based on these spore forming bacteria a year. And that if we do proper cooling, proper reheating, we can lower those statistics. Now I'd like to turn this over to my fellow inspector, Adam Evans.
All right, as Heidi mentioned, my name's Adam. I'm a food inspector and I do the area south of Wichita. So I'm doing the reheating requirements, so I'll just jump right into it. So when reheating leftover foods, we want to make sure to get it from a refrigeration temperature of 41 degrees up to 165 degrees in 2 hours. Once you hit that 165, you can then drop it down to your hot holding temperature of at least 135 degrees. It's important to reheat to 165 because that's an instant kill temperature. That'll kill any existing pathogens that are inside that food. If your food ever drops below that 135 hot holding temperature, make sure to reheat it back up to that 165. Make sure to do it in 2 hours or less. Methods for reheating, direct heat is the best. So think stovetops, grills, ovens, things like that. Really any heating product or device that works as long as you hit that 165 within 2 hours. Microwaves you can use. There are some things you need to be aware of with microwaves. They do produce cold spots throughout, so you want to make sure that you're stirring the product frequently during that reheating process with a microwave. Microwaves will keep cooking for 2 minutes after you're done reheating. So just let it sit for a little bit. Make sure the products that you're reheating in, the lid and the container are both microwave safe. We don't want you melting a plastic container in there or anything like that. We don't recommend that you use steam tables or crock pots to reheat. Steam tables, they're designed to maintain temperature. They're not really designed for reheating. And crock pots, they're slow cookers, so they're gonna bring that temperature up really slow. So you're probably not gonna hit that 165 temperature in that 2 hour time frame. Pathogens of concern during reheating, Bacillus cereus, Clostridium perfringens, like Heidi mentioned, you know, they're spore forming. Those spores are really indestructible, almost, I would say. At least not for cooking purposes. You're gonna ruin your food if you try to kill all the spores. And then Staphylococcus aureus or staph. Staph produces a toxin that can't be inactivated during the reheating process. Its big concern with reheating and staph is that there's it's a long time frame from when you cook to when you get to the reheating process, so there's a large time to get the food, the food can be contaminated. So it's important to make sure that when you're not dealing with the food, that it's covered. When you are handling the food, you're kind of doing it in a low traffic area. And then of course, don't directly contact any of the food. Tools of the trade, thermometer and a watch or a clock, something to keep track of time. So you know you're hitting the right temperatures and times. And then there's another thing that we have, or another thing that's out there called data loggers. Data loggers are cheap, it's affordable piece of equipment. They take time and temperature at set intervals, and then you can display it on a graph. It will show you it'll show you how your foods are reheating or cooling. I recommend everybody out there getting one. If cooling and reheating a lot of foods, it'll show you like how quickly and how slowly you're reheating or cooling, and they're really cheap. Here's a graph of one. So this was an experiment I did at my house with a crock pot and chili. So I just made a batch of chili and then wanted to reheat it, and I used a crock pot, and as you can see, after 2 hours, it only reached 158 degrees. So in this scenario, we throw it out. So think about that at your restaurant. If you're reheating leftover foods, thick foods, they're not gonna reheat in a crock pot within 2 hours. And then this next one is cooling. So I kind of wanted to test the cooling out as well. So what I did was I just boiled some water on a stovetop, pulled it from heat, let it sit for 20 minutes on the counter, and then put it in my fridge, and it was with the lid ajar, slightly vented. After 2 hours in the fridge, it had only reached 80 degrees, which is not acceptable. We wanted to get it down to 70. Now for 6 hours, it was at 55 degrees, which again, not acceptable. And if you look at the very end, there's a small 43. So after the next day, when I checked it, it still wasn't down to refrigerator temperature. So definitely you want to follow the cooling practices that Heidi talked about. Just to make sure to get your food down out of that temperature danger zone. In summary, for cooling, make sure to get your food down from 2 hours, or excuse me, from 135 to 70 in 2 hours. And then 6 hours total, get it down to 41 degrees. For reheating, get it from refrigerator temperature of 41 to 165 degrees in 2 hours total. The real key for both of these is keep the food out of the temperature danger zone. We talked about those bacteria, they're spore formers, or they produce toxins that we can't inactivate. So you want to get it out of that danger zone where bacteria will produce those toxins and those spores. Just get them out there as quickly as possible. If you want any help going over your cooling or reheating practices, feel free to reach out to one of your food inspectors. If you don't know how to get a hold of them, you can call our Manhattan office and they will reach out on your behalf. You guys can get something scheduled. You can go over both of your processes, but don't wait on us. Just start practicing, start studying it today. So with that, I'll throw it back to Ben.
All right, thank you very much, Heidi and Adam. Yeah, do we have any questions from the chat or from the gallery? Yes,
Hi, this is Pat Parker. I'm also another inspector for Kansas Department of Agriculture. Adam, I wanted to ask you, when you did the water, I think it was excellent that you were testing out, but I wanted to know what the volume was. And then what kind of container that you put in there? So did you have like a liter of water, or are you in a plastic container, are you in a metal container? Was it tall? Was it flat? Could you describe what you did?
But it was just, I didn't measure the water out, but it was a metal pot that you would have at home. And I basically just heated it up and just threw it right in the, or not right, about 20 minutes afterwards. We were trying to simulate what it would do from things I had come across in the food inspection.
So can you guess about how much the volume was?
Maybe a liter.
Okay, and
No.
was it in a tall container or a flatter?
It was a tall pot, like 6
Tall.
inch tall pot, 6 by 6 or whatever. What that would be.
Thank you.
Hi, Adam Inman again, assistant program manager here with Food Safety and Lodging Program. Just a really fascinating area for me, this cooling and reheating, and a couple of key points I just wanted to build on that tremendous presentation. Is that really keeping in mind that driving temperature, both for cooling and for reheating, is what sets the pace of that in many ways. And so, like Adam, I think you need to check your refrigerator temperature to start with, right? Because you never got
I did check it, it was at 39, all other.
39,
were at
okay,
39.
so his refrigerator is 39 and the water only got to 43, so I thought that was an interesting finding. There's been some really great experimental studies conducted recently on the cooling, particularly in that 2-inch cooling method that Heidi mentioned is so powerful. If the product is at 2 inches and you're in a cooler that's below 41 and you have good surface area and decent airflow, it's gonna reach those parameters. So the data loggers are inexpensive, as Adam mentioned, and can be used to confirm your process. But if you're doing that cooling and the product level is less than 2 inches, you're gonna meet the cooling parameters in a proper cooler. So that just makes it basically as close to set it and forget it as you can get. And so that's regardless of metal or plastic as well. Very, very minimal impact on that material, because all that, the vast majority of that heat is coming out through the surface area. And so that's where that surface area is so important. So some really fun stuff there, as Adam and Heidi mentioned. If you have any questions with your particular processes, let us know. I will call out one other fun story looking back, since there were no serious injuries, but we did have one establishment that had twice within about a year period. It was kind of related to the Staph aureus that Adam mentioned, which is primarily primary reservoirs in human beings. And so we had a product that was manipulated with bare hands of the food employees and then temperature abused. And that'll contaminated the product with Staph aureus, and with the temperature abuse allowed it to grow to the significant levels that are required for toxin formation. And then they made the rough numbers. The study is available on KDHE's website if you want to look at the outbreak investigation. But like, I think of the one instance had about 27 customers that were, several of them went to the emergency room because it's such a violent illness. And as Adam mentioned, well, it's a heat stable toxin, which means you're not gonna be able to cook that out. And then as he mentioned with those spores, that's gonna be a high temperature, high pressure process to be able to actually destroy those spores. So that's why we control most of those spore formers with these other interventions. But yeah, I just obviously love this subject, so I appreciate that presentation. Thanks again.
We do have one question online from our epidemiologist, Dan, from earlier. He asks, how do you have potlucks at work if crock pots won't reheat the food fast enough?
That's fresh food.
The answer from the room was, it is fresh food.
Or you heat it before you put it in the crock pot.
Or you could heat it before it goes in.
You don't sell it to the public, so we don't regulate it.
Those online that didn't hear, Adam's key point is it's not going to commerce. It's. Was there anything else from the room? I'll give it a little bit for online in case anyone's typing right now. But I will keep this moving. Thank you again, Heidi and Adam, and then additional comments from Another Adam. Next, we're gonna have Mark Meyer and Sharon Leister to discuss updates to FDA guidance and documentation to expect during a processing inspection. Both Mark and Sharon represent our food processing team. Mark covers the South Central region in Wichita Metro, while Sharon covers the Northeast region in Kansas City Metro. Mark's been with the food processing team for 3 years and Sharon for 6. Take it away, Mark and Sharon.
Thank you. Right, figure it out without turning off the mic. All right, great. Locating the clicker. There we go. Thank you. Okay, like Ben said, my name is Mark. Mark Meyer. I work for the food processing team under food safety and lodging. So we regulate foods that are going into wholesale, non-meat based foods going into wholesale. So I think anything that falls under FDA regulation is pretty much going to fall under our jurisdiction. And so because of that, we kind of have our eye on FDA and what they are saying in their updates to their guidances for industry. So I'm going to just kind of cover some of the bigger changes and updates to guidance that FDA has released over the past year. So the main things that have changed were 4 big areas. New guidance from FDA is removing red number 3 as a acceptable dye in human foods. That ban goes into effect January 15th in 2027. So they've announced it and industry is starting to look at reformulations and other alternatives to red number 3. Brominated vegetable oil has been banned in human foods, and that actually went into effect last year, August of 2024. And we'll go into each of these a little more in detail here. There's also been some key updates to the food allergen labeling guidance for industry, and new updates for and requirements for using the term healthy as a claim when it comes to food. So jumping in a little bit to red number 3, what is it? It's a dye, right? It's a synthetic dye, and it has been used for many years to give you that really bright cherry red color. So you see it most often. It was seen in candies, baked goods, cupcakes, cakes, frostings, things like that. And it's also been used in the drug industry. So what has changed and why? FDA revoked the authorization for the use in food and in ingested drugs. And FDA is citing the 2022 color additive petition by the Center for Science in Public Interest et al. So there was a lot of research behind that, and the public, they put in the petition and FDA reviewed it and said, yep, they're going to move forward with that, and it's in process. So again, I think that was, let me back up real quick, January 15th, 2027. So coming up. Onto the brominated vegetable oil. So that's for short BVO. And it is a vegetable oil that's been modified with bromine, and has been used as a stabilizer for fruit flavorings and beverages and sodas. And it has been used as a food additive since the 1920s. Why has it been banned? FDA cites a study, toxicological evaluation of brominated vegetable oil in Sprague-Dowley rats. It essentially showed that the ingestion of BVO causes negative effects to the thyroid, and at high doses, it resulted in the perturbation of the hypothalamic pituitary thyroid axis. I'm not a medical professional. I didn't dive too deep into that. I'm trusting that they know what they were talking about. So who is going to be affected by this change? BVO was predominantly used in commercial soft drinks and as an emulsifier for flavoring. So it's going to be really the only place it was in is it focused on citrus flavors and getting the citrus flavors to not just sit on the top of the beverage. It made a conducive beverage that the flavor was all the way through. The revoking of the regulation allowing for this BBO went into effect August 2nd, 2024. So it should no longer be in any foods. We got some pretty widespread updates to allergens and allergen labeling. So first I wanted to touch on what is the guidance for industry that's been updated. So the guidance of industry is a document released by FDA. It's 27 pages. It's a difficult read sometimes because of the regulation and the verbiage, but it's really useful, especially if you want to start wholesaling your product and getting your food, especially across state lines. We recommend that you read through the guidance for industry in regards to food allergens. The updated guidance for industry was released in January 2025, so just recently. And it spells out best practices and represents the current thinking for Food, Drug and Administration on the topic of food allergy labeling. So when we're talking about food allergens, we're talking about the 9 main food allergens: milk, eggs, fish, crustaceans, peanuts, tree nuts, soy, and wheat. So what has specifically been updated? FDA has narrowed the definition of tree nuts and what falls under tree nuts that require an allergen call out on a label. So the table here on this slide indicates the tree nuts for which a robust body of scientific evidence supports the inclusion in the list. So those are going to be almonds, Brazil nuts, cashews, hazelnuts, macadamia nuts, pecans, pine nuts, pistachios, and all walnuts. Now, notably, what has been removed from this list that we see the most often is coconut and chestnut are the 2 that I have seen the most often in foods that have been pulled off of this list, requiring them for allergen callouts. So they are no longer considered tree nuts by allergen guidance for industry. There's also been an update for the definition and the requirements for eggs as an allergen. The updated definition for the main allergen egg is as follows: eggs from domesticated chickens, ducks, geese, quail, or other fowl. So what does that mean and what is the change? The change essentially says if you are using an egg that's not from a chicken, we need to call out the source. So eggs and egg ingredients from birds other than chickens should include the name of the bird source, being a duck egg, or contains eggs, or ovalbumin quail egg. So we're calling out what kind it is. There are people who have allergens to specific eggs from specific fowl. Very similarly, milk is basically adopting the same requirements as eggs are. So the updated definition for milk: milk from domesticated cows, goats, sheep, or other ruminants. And the label changes just require that you call out the source of the milk product. So whether that's goat milk, or if you have whey protein and in parentheses from sheep's milk. We're calling out the source of the milk just so that we have that specific information on the label. And lastly, the term healthy as used as a claim in food. So this there was an original definition and requirements that foods had to meet to be so that they could use the term healthy as a claim. And they announced the updated criteria for this claim December of 2024. And this will be enforceable by FDA starting February 25th, 2028. So what are these requirements? The food must contain a certain amount of food from at least one of the food groups or subgroups recommended by the Dietary Guidelines for Americans. So fruits, vegetables, grains, proteins, dairy, things like that. The foods must also meet specific limits for added sugars, saturated fats, and sodium. The criteria for how much food from a particular food group is required, or it's also called food group equivalents, and the specific limits for those 3 individual nutrients will vary for each individual food product, mixed product, and they are based on a reference amount customarily consumed, which is the basis for determining a serving size. And then
On this, when they post these slides next week, this link will take you to a page where it kind of has a compare contrast of what are the old requirements and what are the new requirements look like. I'm not gonna click it because I don't want to mess up everybody's slides. But you can see it there and I'll kind of go over some of the changes. The new requirements for healthy no longer have a limit on total fat or dietary cholesterol. They do have a new limit on added sugar. The changes reflect the current nutrition science and dietary guidance in the dietary guidelines for America. There used to be a requirement for the minimum amount of beneficial and individual nutrients, where you see a lot of things like enriched white bread or enriched flour that they have those nutrients added into them. Now we're going to be looking more for a minimum amount of recommended food groups. So we have a broader base of food. So you can kind of see down here on the slide, the bottom left shows things that would have qualified under the old definition, things like enriched white bread, yogurts, flavored yogurts that are high in added sugars. And then we're looking at what is going to qualify as under the new definition, and that will be things like eggs, salmon, trail mix with dried nuts or with dried fruit and nuts, plain or low-fat yogurt, eggs, 100% olive oil, water, things like that. And that's the end of my half of this food processing presentation. And I'll invite my coworker, Sharon, to come up and give hers.
Good afternoon. So all of the food processing inspectors are also credentialed contracted FDA investigators. And during those inspections, especially during those inspections, we look at a lot of records. So that's what this is over. We look at documentation and records during an inspection because KDA food processing inspectors conduct a variety of different types of inspections that include preventative controls inspections, limited scope inspections, and qualified facility inspections under 21 CFR 117, otherwise known as the Food Safety Modernization Act, or FSMA for short, and current good manufacturing practices, or CGMP inspections under 21 CFR 110. During inspections, inspectors will ask questions regarding the firm's food safety plan if required. This plan is a systematic approach to identify, evaluate, and control food safety hazards to prevent or minimize the risk of foodborne illness or injuries. These written plans include ingredient and processing hazard analysis that identify steps in the firm's process that require monitoring to prevent or minimize a hazard. These monitoring steps are referred to as preventive controls. For firms that are not required to have a food safety plan and operate under a HACCP plan or a hazard analysis critical control plan, these controls would be critical control points. In industry, these terms have become interchangeable at times. So a lot of times we'll go in and they'll have a food safety plan, but they'll say it's a HACCP plan. Requirements for FSMA. These required elements, are required elements for facilities covered by the full FSMA requirements will be covered. Some of the requirements discussed today are not required for facilities that meet one of the exemptions for food facility registration under FSMA. However, they are good practices to follow and can easily be incorporated into any facility's records, helping to ensure products are safe for human consumption and preparing any facility who is close to meeting the requirements for food facility registration with FDA. Monitoring records verify the effectiveness of processes such as lethality treatments and metal detection, while calibration records support accuracy of the equipment being used to measure preventive control points during the process. Training records document training of new employees and the continuation of training for all employees. It is important to remember that if it isn't written down or recorded, it didn't happen. As we review the slide, keep in mind the various types of records that may be relevant during an inspection. Records should be kept for a minimum of 2 years and able to be accessed within 24 hours upon a verbal request by the inspector. So initially, an inspector may request facility maps and process flow diagrams, which allow a visual representation of the flow of product through the facility and the streamlined process. Depending on the type of inspection being performed, additional records may be reviewed, including batch records and or formulation records for the recipe, environmental monitoring records, consumer complaint logs, corrective action logs or reports, and a mock recall report. Temperature monitoring logs include cooler temps, thermal processing temps, and cooling temperatures. Water testing results, which may include annual testing reports for the municipal water source or performed annually for private water sources. Sanitation records could be master cleaning schedules, employee hygiene monitoring records in the case of juice producers, and documentation of pre-operational inspections. Calibration monitoring logs would be records like scale certifications, pH meter calibration logs, thermometer calibration logs, and sanitizer concentration titration logs when applicable. Validation records show the process you are monitoring or observing is reaching the required threshold that has been deemed as an acceptable lower level for safety. It is important to note that facilities will typically set an operational threshold to trigger corrective actions that is above the known accepted or scientific lower limit to ensure customer safety. Whatever is in your written program is what you will be held to for your critical action limit. Calibration records are records that show your equipment being used to monitor your processing controls are working correctly. Equipment calibrations for equipment should be conducted per the manufacturer's direction and can vary between manufacturers and even models. Monitoring records typically have parameters associated with minimum and maximum values and corrective actions and corrections, verification, and validation. Key elements capture what is happening during the monitoring activity and should be detailed enough to allow an individual not familiar with monitoring steps and requirements to draw accurate conclusions regarding the actions or actions being performed. Records that monitor preventative controls should be reviewed within 7 days of production. The person performing the records review should be looking for completeness of records. Was everything filled out correctly? Were the checks done on time? If not, is there a reason for the time lapse reported? Were the critical limits met? If not, was there a corrective action performed? Check marks and X's are ambiguous and do not specify the result of the action performed. Check marks can be used if the meaning of the check mark is implicitly designated on the monitoring form. For example, statement on the form, the check mark equals pass and an X equals fail. Records must be original, accurate, indelible, and legible. Records can be scanned or photocopies of original records can be kept electronically through monitoring programs such as Red Zone, which is used in manufacturing, or Oracle for supply chain, and Prestige, which is used in several bottled water productions. Just to name a few, the electronics. Employees' training should be, or should ideally be done at a minimum prior to working on the production floor for new employees, with annual refresher training for all employees, covering the major food safety topics such as CGMPs, employee health and hygiene, allergens, and any other relevant food safety issues relevant to the firm's process. Trainings can encapsulate online, virtual, monthly toolbox sessions, or on the spot, in person, at the plant, and etc. Training records should include the following items. The person doing the training should always be, or training should always be an ongoing process and can be refreshers for time-established processes such as hand washing or new topics or updates. For example, the latest draft guidance from FDA regarding allergen labeling. Individuals providing the training should not be signing off on their own training. I have actually seen that multiple times. You cannot train yourself. Training topics such as annual meetings should be avoided, and topic descriptions such as CGMPs, metal detection, and allergens should be used to provide more specific topics of training. That's it.
Thank you, Mark and Sharon, for the updates and information. Before we go on, I do have to check for questions. Are there any from the room? I did not see any in the chat. Yes, we have a few.
Thank you. Roger Abbott, Custom Foods and Soda Cans. And this is really probably for anybody KDA in the room. A lot of state legislatures I'm seeing are passing laws, food safety laws. You mentioned red dye number 3, that's one of them in California, Colorado, West Virginia. A lot of states are passing specific laws, which frankly are gonna make it hard for nationalized companies to do business in individual states with different laws. And one of particular concern, that I've seen recently, Louisiana, I believe, just signed something, where bleached wheat flour, they're requiring a QR code on the case of food, to link to a website that says, something about, has been linked to health issues or something like that. Anyway, the point is, I think industry's kind of being asked to have state-specific, labeling issues. I haven't heard of anything like that in Kansas legislature, but I don't know, anybody with KDA, have you guys heard anything about that, in Kansas?
Well, you look back historically, traditionally Kansas hasn't taken California or Louisiana approach to regulating that, but in my opening remarks, I mentioned something about FDA funding and things like that. And cooperative agreements and cooperating, these adopt FDA guidelines that in most of all of our food, milk, feed programs are pesticide, EPA guidelines, USDA, and poultry guidelines. And once those cooperative agreements get done, we share your concerns. We've experienced some in like labor laws that we just talked about. It forces companies to have labels specific, just like you said, for that state. Traditionally, Kansas hasn't done that. I don't see any movement with our legislators to do that right now. And we're very, like Amber or Jamie and Pete, so we recognize that that creates a burden. We have several national companies to distribute across many state lines. It does create a burden and we've heard those concerns before, so we're looking out for, trying to as best we can.
Very good, thank you.
Hi, I'm Karen Maggie with Flint Hills Pines. Got a question on the labeling. When you had your tree nuts up, I did not see peanuts listed. So am I still required to list peanuts?
This is marketing with food processing. So in answer to your question, yes, peanuts are not considered a tree nut. They are their own category. They are grown underground, and are a living technically. So they are not a tree nut. They don't fall under that. But tree nuts and peanuts are both still required callouts for a.
Okay. I got a couple more for you. Courtney's getting a break, so.
Ben, she said
She's got two.
right. A little closer to
Eggs. We only use the yolks to the eggs, we don't use the whole egg. So in the ingredients section, we list egg yolks. Then there's another section that we have contains. We have milk, egg, wheat, soy, and nut. So, do I have to put the egg comes from the chicken, or we?
My current understanding, and if anyone knows better, please correct me, is, the default egg refers to chicken eggs. And if it is the egg from a different species of fowl, that is when the call out is required. So if you were for some reason using quail eggs in your ice cream, and using the oat yolks from quail eggs, then you would call out quail eggs specifically. But at the moment, egg, just the blanket term egg refers to chicken eggs.
Next one's with the cow and milk. So is default for cow? Awesome.
Yes, same thing, milk is going to default to bovine milk. Other ruminants just need to be called out, as applicable, whether it be goat milk specific, but milk will be defaulted to cow. All right, thank you so much. There you go.
Is the food inspection checklist used by the inspector available to us on website? Use for our own use?
That reads on manufacturing. Retail. Sorry, is that for retail or manufacturing, food inspection?
Manufacturing.
Manufacturing. Courtney? Answer this one.
We don't have a specific checklist, that says, what you need to specifically be like looking at, just, we have a list of questions that we ask and things that we look at according to, your facility, so it's categorized, pertaining to like times and grounds, sanitary operations. Is that what you're asking?
Settings like that.
Yeah.
Well, see the commercial.
Yeah.
Yes, George mentioned the regulations are available. We can help connect you with that. We can provide just a blank of our good manufacturing practice or general inspection report. We can get you a blank copy of that, but then all of them are available on a public search as well. And that just lists the category areas that folks are looking at during the inspection. But at least from the GMP perspective. So we'll connect with you, get you what you're looking for.
So you don't have a template per se?
It depends on what you're talking about, but the inspection report is available, and that's the kind of the mainline information capture that has, we get a manufacturer, how many questions are on. 42 questions that we have on that are addressed one way or the other in most typical food processing plant inspections, and there's a 50 some that are on the retail equivalent. So you can see real world examples on the public search that's available for consumers to look up inspection reports. If you just wanted to see examples of those that have been adapted, we can also just give you kind of a blank copy of that.
And we have our CFRs that we're going by, that's the Code of Federal Regulations, and so, those are
pieced out by subparts in the CFR, but those, subparts that are within the CFR also are how we have listed out on our inspection report. And the area for that facility, like that type of inspection, so 21 CFR 110 for the state of Kansas. Would be for a state inspection, and then for a federal inspection, it would be under 21 CFR 117.
The discussion from the room, was there anything online I missed? Okay, thank you again, Mark and Sharon, for the updates, and yeah, appreciate the discussion in the room. We will have time at the very end if any more questions come up. But for right now, we're gonna welcome our final presenter, last but not least, of course. We have Jamie Spencer with our Dairy and Food Safety Program. He's gonna discuss highly pathogenic avian influenza, or HPAI, in raw pet food. Jamie's been with the Kansas Department of Agriculture for 25 years and who represents the feed program.
Thank you, Ben. Hey, you're my next. Here, put on the next.
Yeah, there you go.
Very good. Okay. Like Ben said, my name is Jamie Spencer. I'm with the, feed and dairy and inspection, side. So I'm the, feed, or animal food technical specialist. And today I would like to just briefly talk about, the highly pathogenic avian influenza. Okay. HP. Yeah, try to make this entertaining, because listening to me is not that entertaining, so.
It's advancing, it's going on its own.
You're cheating, you're fast forwarding through all my wonderful slides. I will refer to the highly pathogenic avian influenza as either HIPATH or HPAI because it's just easier to say. It's been known as also as the bird flu. Of course, it's been a topic of conversation in the avian industry for a couple of years. Recently, we have discovered that it has crossed over to other species as well. The American Veterinary Medical Association has reported as extremely rare for domestic poultry to recover from an infection from HPAI. Some strains of the virus will show 100% mortality rate within 48 hours. Wild migratory birds appear to be less affected by the virus. Even though they may be less affected by the virus, they may still become carriers of the virus. For backyard birds and pets alike, treatment typically needs to begin immediately and the animal is placed in isolation to protect other animals and the humans from exposure to the virus. Because there's no specific treatment for HIPATH, your veterinarian may focus on supporting the animal's health and comfort as their body attempts to fight off the infection. As time has passed, the virus, particularly the H5N1 strain, has exhibited impacts on other species. In the past year, dairy herds have been affected. Maybe I use it quicker. Dairy herds in Kansas and other states have been affected by the virus. Although the virus has shown mortality to be very low in dairy cattle, the cattle will show typical signs of flu, such as a decrease in feed intake and rumination, respiratory signs such as a nasal discharge, and a sudden drop in milk production. Some of the cows will exhibit a colostrum-like milk. The milk from affected cows is known to contain the live virus. Consuming raw dairy products, including raw milk, yogurt, and cheese, can cause an infection of the H5N1 HIPATH avian influenza in humans and other animals. The virus by nature is highly pathogenic and zoonotic, meaning that it is easily transmissible to other species through contact with raw milk or other infected material or equipment. Pasteurization has been shown to be effective in killing the virus. The H5N1 virus can infect dogs. Dogs can contract the HPAI through contact with infected birds, contaminated environments, or by consuming raw or undercooked meat and milk products from infected animals. The impact on dogs appears to be less severe than in cats. The Oregon. Okay, here we go. Now we're to cats. The Oregon and Washington Departments of Agriculture, and we're moving on. The Oregon and Washington Departments of Agriculture have had several cases of high path infection in cats. Since the current HPAI outbreak began, many domestic cats, including pets, barn cats, feral cats, and even wild cats, have been infected and become severely ill or died from high path. I don't think any K-State wildcats have gotten ill. We're good there. Right. I'll say the Jayhawks may be the carrier of. But that's for another day. Cats can be exposed to the virus and infected with direct contact with infected birds from their environment, from consuming contaminated raw meat or unpasteurized milk. In 2 cases in Washington, cats had consumed the same brand of raw pet food. It's gonna go. Yep, all right. Just headed off the pass here. Some recommendations, do not feed pets undercooked or raw meat, including uncooked or freeze-dried meat-based diets, treats, or other animal products. Freeze drying has not been shown to be effective in destroying the virus. Do not feed pets raw milk or colostrum, meaning unpasteurized. Keep pets away from wild birds, poultry, and cattle, especially in areas with known H5N1 outbreaks. Preventing pets from eating birds or other wild animals. Washing hands after handling raw meat and after any encounter with poultry, livestock, or wild animals. If you interact with any sick or dead animals that may harbor avian influenza virus, change your clothes and shoes and wash your hands thoroughly. And if you suspect your pet may be infected with the avian influenza virus, contact your veterinarian immediately. Hold up. Sure. Okay. And how does this affect our pet food manufacturers? Pet food manufacturers that use raw meat, poultry, and milk products will be required to address these ingredients in their hazard analysis and their food safety plans. Like any known or reasonably foreseeable hazard, there are multiple avenues for controlling it. There could be supply chain controls, process controls, etc. As with any preventive control or critical control point, the firm should have or develop validation procedures to ensure the control is effective. Current testing for the virus has so far been unable to detect, has only been able to detect the presence of the virus, not whether it's live or dead. At the time that I did this research, a method for detection of the live virus or the killed virus was not reliable. Since this is a novel virus, there's a lot of information on treating the virus in animal food. And science is still evolving for this virus, so resources may be hard to find. The impact, regulatory changes, the Food Safety Modernization Act and the Preventive Controls for Animal Food or PCAF will require pet food manufacturers to identify and address potential hazards. The FDA has determined that HPAI is a known or reasonably foreseeable hazard for pet food manufacturers using raw, uncooked, or unpasteurized ingredients from poultry and cattle. And then manufacturers must analyze their food safety plans to incorporate high-path avian influenza as a known or reasonably foreseeable hazard and implement preventive controls. So some potential risks: high path can contaminate raw pet food, potentially causing illness or death in cats, according to an article from the All Pet Food website. Cats have been reported to become sick and die after consuming raw pet food contaminated with high path avian influenza. And that was from an article in the pet food industry website. Dogs can also be infected with high path avian influenza, although their symptoms are typically milder than those of cats, according to an article in the Food Safety Magazine website. And to date, I don't know of any dogs that have died from high path avian influenza, but they can become ill. And the virus can spread through raw meat, poultry, milk products, or other contaminated ingredients. So mitigation strategies, manufacturers, of course, are encouraged to source their ingredients from healthy flocks and herds. Implementing heat treatments or high pressure processing can help to inactivate the virus. Rigorous sanitation procedures and quality control measures are crucial throughout the manufacturing process. And manufacturers should implement controls throughout the supply and distribution chains to ensure ingredients do not come from high path avian influenza infected animals or are blended with ingredients that could be contaminated. Ensure that kill steps are used to deactivate the virus and that they are effective. Have procedures in place to minimize the risk of contamination coming from employees, processes, practices, and the environment. So what does this mean for consumers? Just try to get rid of me quickly. For consumers, until more information becomes available for alternatives to heat or pressure processed pet food, I could not recommend feeding pets, especially cats, raw meat, poultry, or milk products. Some brands offer gently cooked or minimally processed options. My advice would be to contact the manufacturer and inquire about their strategies to mitigate HPAI, and more specifically the H5N1 in their food. And as always, consult your veterinarian when making decisions about your pet's needs, and especially as it pertains to their nutrition and safety. See if it stays on to the end. Any questions? All right. Thank you. Here, you hold that, I'll make it. Here, I can drag it.
So this is Pat Parker with KDA. So the question is, if it could cross, if it jumps across species, are there testings like they are for the birds with the beef and that sort of stuff? To make sure it doesn't go into the food chain or the pet food? You know, those are getting a lot of processing raw food. I don't know. I'm just.
So, well, and I haven't looked at this for a couple months. But when I last looked, there are not real reliable sources for identifying whether it's they can detect the virus. But it's been a little more difficult detecting whether it's dead or alive. So if, I guess my recommendation for anyone, I guess, is, kind of be sure to source your products from sources that appear healthy, right? So, a lot of the, something that's been passed for human food probably has a better likelihood of not being contaminated with iPad. Versus, a sick, dead, diseased, or dying animal. Someone's put down, so how do you know that? There's, again, contact manufacturer or, like I say, source your materials from, people who are either testing or have some protocols in place to, have a kill step. And, what they're doing to do that, I keep that.
One more question. So, with the birds, just like other livestock where they inoculate for certain pathogens, is there an inoculation for this, for the bird flu?
Not currently that I'm aware of. My guess is that someone's working on that.
It's been around for a while.
It's been around a while, but it takes time.
Gotcha. Thank you.
Yeah, well, any other questions?
Oh. He had a question, but she answered it,
Okay.
or she asked it.
All right. Thank you again, Jamie.
You're welcome.
All right, and again, I just would like to thank all of our speakers that we had here today, and also for the rest of you for joining us. I know it's taken a few hours out of your afternoon right before a holiday, so we definitely appreciate that. As we wrap up today's meeting, we have set aside rest of the hour to dedicate to general questions for any of our KDA staff. Questions for anybody. Our K-State speakers did have to leave, but if there are any questions for them, we'll get them to them and get your questions answered. So I'm just gonna open it up and sit in awkward silence.
I've got a question. This is Gabby Garrett. So when we were talking about salmonella, there was salmonella typhi and salmonella non-typhi. What exactly is the difference between the two different types? Is it like a genome sequence or something?
Yeah, so salmonella has hundreds of different serotypes. And salmonella typhi, just because of its makeup and the way that it causes infections in people, often causes symptoms that are a little different than traditional salmonella. And that's why it has its own name of typhoid fever. It gets even more complicated because some serotypes cause something called paratyphoid fever. And then there are, like I said, hundreds and hundreds of other serotypes that can just cause non-typhoidal salmonella. And the testing process for salmonella, it can take some time to get to the point where you actually have that information about what serotype the salmonella is and whether it's typhi or non-typhi. But generally speaking, if someone didn't have international travel, we assume they have non-typhi salmonella. That process to get a whole genome sequence on bacteria, that happens at the state laboratory. And it takes, 10 days to 2 weeks from the time that we receive the specimen to the time where we're actually seeing the actual sequence of the bacteria and looking for matches in that national database to try to detect outbreaks. Once we do see a match, we're really sure things came from the same place. So that's a big improvement over, foodborne cluster detection in the past. But we do have to wait for that laboratory process to work itself out before we find that information.
Thank you.
All right, if there is nothing else, then I will go ahead and wrap. Again, we will put these slides online. They have all the contact information and have all those helpful links in them. So if anything comes up, let one of us know and we'll try to question answer it. And I do have a comment from the back of the room.
When is the Zoom link or recording available?
The question is, when is the Zoom link for recording available?
Next week.
The answer is next week. So it'll be, I think we'll have it sent out to everybody who was on the email list. And again, in our Food Protection Task Force newsletter, I will also put a link in there to make sure that everybody can go watch the recording should they want to. And also, again, slides will be posted online, so you can refer to any of those topics that you might be interested in. And the other note, in addition to sending out the recording, we'll be sending out a survey. Please fill out the survey, give us your feedback, let us know anything that you might want to see as topics for next year, or topics for the newsletter, or any other comments, concerns you may have. So again, thank everyone for your time, and I guess that's us signing off. Thank you.